Hey everybody, it's Dr. Cameron Dennis, physical therapist with Back on Track Therapy and Wellness. I'm also the founder of the Running Injury Support Group, and I wanted to talk about rebuilding strength and endurance post-injury. So there are probably hundreds of hours that I could fill just talking about this one subject. I mean, literally rebuilding strength and endurance post-injury. That's my profession. So there are literally conferences, and I mean, it's a huge topic to say the least. So um, I want to talk about general considerations for people who are having difficulty with this. So obviously with running, injuries are fairly common. um, and I think a lot of people end up re-injuring themselves because they're not exactly sure of the rehabilitative process. They're not exactly sure what it takes to get their body in the condition that needs to be in order to reduce chance of re-injury. So I think it's important that we say that uh, running injuries or injuries in general are um, inevitable. Okay, there's no 100% way to get rid of your risk of injury. It's impossible. Injuries happen. Okay, so let's just get that on the table. Anybody who says that they're 100% able to prevent your injuries is full of crap. Okay, um, but what we can do is design our training program in a way that allows for safe progression from where you are when you're injured. We'll say here to the level of performance that you're wanting to achieve. Which, if it's completing a 5K, that's here. If it's getting a PR, that may be here. Doing a 100-mile trail ultra, that may be here. Okay, so obviously there's this progression, there's this slope. Um, Typically, it's not linear. It's going to be the rehabilitative process. That's a tongue twister. Typically is not linear. I've seen a chart one time. It looked something like this. So rehab looks like this. Okay. The general trend we want is this way, but in general, there's always going to be fallbacks. There's going to be days when you feel great, days when you feel terrible, but there are general things that you can do to help set yourself up for success, though. Okay, so and it really depends on each injury. But as far as getting back to running, let's take a look at a few important considerations that I think are underutilized and underperformed, not only with people individually, but even in therapy. I don't think that physical therapists in general are well trained in returning runners to running. Maybe to their regular activities, but a lot of them don't necessarily have a good understanding of return to running programs and things like that. So, and my understanding is certainly growing all the time. I don't think there's a such thing as a perfect understanding of how to return someone to injury, to running from injury, but it's certainly an evolving process as the research changes every year as well, every day. So let's talk important considerations. So depending on where you're starting, if you're having trouble tolerating exercise, I would say start with isometrics. If you're unfamiliar with isometrics, it just means you're contracting the muscle without moving the joint, without moving the muscle itself. So this is an isometric contraction of my bicep muscle. Okay, so I'm curling up like here, but this arm is resisting it. So that's just an example of what an isometric contraction is. So isometric strength training is generally a good place to start if you have trouble moving. That are passive range of motion, so moving without resistance through a pain-reduced or pain-free range can help to reduce initial pain. Once you're able to tolerate those things, we generally do concentric training, which basically is the up phase, right? When you're doing a bicep curl, for example, the up phase where the muscle is shortening, and then followed closely by eccentric training, which can be a little bit harder on the tendon and the muscle, requires quite a bit more muscle fibers than versus the concentric training. So that's the down phase. Okay, so that actually uses more, to put it simply, I guess, uses more of the muscle than doing the up phase. So I think it's important because running has a lot of the eccentric contraction in it, because you're lowering yourself down. Anytime that you're striking, you're going to be, with every step, using eccentric contraction in one way or another, whether that be the quads or the hamstrings. I would say the hamstrings are a big one. And the hamstrings are also something that I think are commonly undertrained. So we'll go into that a little bit. But so eccentric or eccentric training for the muscles of the legs, definitely important to start and to work on before you get back into attempting running, especially high performance running. So trying to do hundreds and things like that. The other thing that I think is not performed enough is single leg strength training. So running is performed in one leg at a time. So being able to do single leg hops, single leg squats, single leg deadlifts, single leg stance, and toe taps with the opposite leg. I mean, we can do video demonstrations of those, but in general, I think it's important that we do single leg strength training, not just with the affected leg, but with the other leg. Okay, so we're not only improving the strength and the tolerance to standing and operating on that one leg, but we're improving motor control. So the other thing, so I said single leg strength training, but also plyometrics. So plyometrics are going to be more ballistic. They're going to be more similar to running than just doing, for example, a squat. A plyometric would be like a jump, squat. So like a jump, bring your knees to your chest, your feet hit the ground, and you jump immediately up. It's those quick movements, right? So running is a quick thing. Sometimes quicker, and some people, sometimes a little bit quicker in some people versus other people. But in general, it's quick. It requires a quick rebound from the muscles of the lower legs. And so it's important that you get it ready for that. So the jump squats, it's a good thing. The single leg jumping, or pogos, which is, we can do a video on pogos, but what other exercises could we talk about? I can actually do a video on plyometrics. I won't try and squeeze them all into here, but anyway, so those are important things to consider before you try getting back into any type of running. I think if you're looking to improve your chances of not re-injuring that area. And the other thing would be smart training progressions. So not only the strength training aspect, but smart training progressions in your running. So starting with a walking program, once you're able to tolerate long distance of walking, you speed up the walking. Once you're able to tolerate that, what you can do is you can add jogging into your walking program gradually, increasing to more jogging and more running and less walking. Okay, so hopefully that makes sense. So that allows for your body to build a tolerance to the act of running itself. So hopefully that makes sense. I actually have a program that I wrote. It's not perfect. Nobody's program is perfect for everyone, but it just shows in general smart training progressions for your running. So if you're interested in that, let me know. Send me a message and I can send you that. But it basically just says, here's step 1 and here's step 40. Step 1 is just a walking. Step 40 would be getting to a 5K. So it transitions. It shows every single step from 0 to 5K. It's like a couch to 5K, but with a physical therapy sort of tie to it. It's really gradual process. And it's not for everyone, like I said, but maybe for someone who's dealing with an injury and they're having trouble coming up with a smart training progression for running, and they feel like they're constantly trying to do too much and they're constantly overdoing it. So let me know if you want that. And hopefully that answers any questions that you might have. I know Jeremy Johnson asked this question, as he said he's going to be doing 100 actually the Moab 240 in October. So if you're still having hamstring trouble, and if you have any further questions about this, Jeremy, please reach out to me and we can talk a little bit. But hopefully that helps. And if you have anything else that you'd like for me to cover, please let me know. And thank you very much. This, once again, is Dr. Cameron Dennis, physical therapist with Back on Track Therapy and Wellness. And thank you for everyone who stuck around to the video this long. And I'll see you later. Thanks. Bye.